Have you ever walked out of a doctor's office feeling ignored, rushed, or like your concerns were brushed off as just aging? If you're a senior in America, that sinking feeling isn't just in your head. It's a sign of a healthcare system that too often fails older adults. From hidden ageism to rushed appointments and dismissed symptoms, doctors aren't always giving you the care you deserve. In this video, we're exposing 5 brutal truths about what doctors really think of seniors. Truths that could save your health, your dignity, and even your life. Stay until the end to discover powerful strategies to take control of your medical care and demand the respect you've earned, because your voice is the key to thriving at any age. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Truth 1. Ageism is real, and it's stealing your care. Ageism in healthcare is a deeply entrenched, often invisible bias that profoundly affects the quality of medical care older adults receive across the United States. This pervasive prejudice manifests in subtle but harmful ways as healthcare providers, whether consciously or unconsciously, make assumptions about older patients based solely on their chronological age rather than their individual health status, lifestyle, or capacity to benefit from treatment. Studies, such as those conducted by the National Institute on Aging, reveal that many clinicians harbor outdated stereotypes, viewing older adults as inherently frail, less resilient, or simply experiencing inevitable declines that are dismissed as just part of aging. These assumptions can lead to a cascade of negative outcomes: underdiagnosis of treatable conditions, undertreatment of serious illnesses, and a passive approach that prioritizes managing symptoms over pursuing aggressive, potentially life-saving interventions. Consider the case of a 75-year-old patient diagnosed with early-stage lung cancer. Despite being in otherwise good health, with no significant comorbidities, their doctor might hesitate to recommend surgery or chemotherapy, citing concerns about the risks associated with their age. This reluctance can rob the patient of years of active, fulfilling life. A 2023 study published in The Lancet underscored this issue, finding that older adults are significantly less likely to be offered critical procedures, such as heart valve replacements, cancer screenings, or organ transplants, compared to younger patients with comparable health profiles. The study highlighted that age, rather than medical fitness or potential benefits, often drives these decisions. For example, a healthy 80-year-old with early-stage colon cancer might be steered toward palliative care rather than a curative surgery, simply because their doctor assumes they won't tolerate the procedure. This bias doesn't always manifest as outright denial of care. It can appear in more subtle forms, such as a doctor dismissing complaints like fatigue, joint pain, or mild cognitive changes as normal aging, without ordering diagnostic tests to rule out treatable conditions like hypothyroidism, rheumatoid arthritis, or early dementia. Over time, these missed opportunities for early intervention can lead to worsening health, preventable hospitalizations, and a diminished quality of life. Moreover, ageism can erode trust in the healthcare system, leaving seniors feeling marginalized and less likely to seek care when they need it most. What you can do to combat ageism. Fighting ageism in healthcare requires proactive advocacy and a refusal to accept dismissive or inadequate care. If you suspect your concerns are being brushed off due to your age, don't hesitate to challenge your provider directly. Ask specific, pointed questions such as, "Is this recommendation based on my age, or is it rooted in my specific health condition and test results?" Or, "What would you recommend if I were a younger patient with the same symptoms?" Bringing a trusted advocate, such as a family member, close friend, or professional caregiver, to your appointments can provide invaluable support. They can help you articulate your concerns, take detailed notes, and ensure your questions are addressed. If you feel your doctor isn't taking your health seriously, seek a second opinion, preferably from a geriatric specialist who is trained to understand the unique medical needs of older adults and can offer tailored, evidence-based care. Additionally, educate yourself about your condition using reputable sources like the National Institute on Aging or Mayo Clinic websites to better advocate for appropriate treatments. By asserting your right to comprehensive care, you can counteract ageist biases and secure the medical attention you deserve. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Truth 2. Time limits are killing your health. The The U.S. healthcare system operates under relentless time pressures, creating a high-stakes environment where doctors are often forced to rush through patient appointments to meet stringent quotas imposed by insurance companies, hospital systems, or practice administrators. Primary care physicians are typically allotted just 7 to 10 minutes per patient, a time frame that may suffice for addressing straightforward issues like a sore throat or a minor injury in younger patients, but is woefully inadequate for older adults. Seniors often manage multiple chronic conditions, such as diabetes, hypertension, heart disease, or arthritis, alongside complex medication regimens and subtle symptoms that require careful, time-intensive evaluation. This rushed approach can have catastrophic consequences, leading to missed diagnoses, inadequate treatment plans, and preventable health crises. A 2024 report from the American Medical Association highlighted the scope of this problem, revealing that 60% of primary care visits for seniors involve managing at least 3 chronic conditions, yet the average appointment length has not increased in decades. In these brief encounters, doctors may lack the time to thoroughly review a patient's medical history, explore the nuances of their symptoms, or consider how their conditions and medications interact. For example, early signs of heart failure, such as shortness of breath or swelling in the legs, might be dismissed as normal aging or attributed to an existing condition without further investigation. Similarly, subtle cognitive changes that could signal early dementia or medication side effects might be overlooked due to time constraints, delaying critical interventions that could slow disease progression. The consequences of these rushed visits can be severe. A missed diagnosis of a treatable condition, such as anemia or early-stage cancer, can escalate into a medical emergency, leading to hospitalizations, reduced independence, and a diminished quality of life. For instance, a senior reporting vague symptoms like fatigue or unintentional weight loss might leave an appointment with a generic recommendation to rest more, rather than a referral for blood tests or imaging that could uncover a serious underlying issue. Over time, these oversights can erode health and rob seniors of years of vitality. What you can do to navigate time constraints. To maximize the value of your limited time with your doctor, preparation is key. Before your appointment, create a detailed yet concise list of your symptoms, including when they started, their severity, and any patterns you've noticed. Include a complete list of your current medications, with dosages, and any over-the-counter supplements, as well as a prioritized list of your top 3 to 5 concerns. Share this list at the start of your visit to keep the conversation focused. If your doctor seems rushed or tries to move on before addressing your concerns, politely assert yourself by saying, "I need a few more minutes to discuss this thoroughly. It's critical for my health." Don't be afraid to request additional time or schedule a follow-up appointment to address unresolved issues. For complex conditions, such as heart disease or neurological symptoms, ask for a referral to a specialist who can dedicate more time to your case. Additionally, consider using telehealth follow-ups for quick check-ins, which can sometimes offer more flexibility than in-person visits. By being organized and assertive, you can ensure your healthcare needs are fully addressed despite systemic time constraints. What you can do to navigate time constraints. Preparation is your greatest asset in a time-constrained healthcare system. Before your appointment, create a concise list of your symptoms, current medications, including dosages, and any questions you have for your doctor. Prioritize your top 3 concerns to ensure they're addressed, even in a short visit. If the doctor seems rushed or tries to move on before you're satisfied, politely but firmly request more time by saying, "I need a few more minutes to fully understand this. It's critical for my health." Don't hesitate to schedule follow-up appointments to address unresolved issues or request referrals to specialists for complex conditions like heart disease or neurological concerns. By being proactive and organized, you can maximize the value of your limited time with your doctor and advocate for the thorough care you need. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Truth 3. Doctors assume you won't understand, and it's costing you. A significant communication gap exists in healthcare, where some doctors, whether due to time pressures, unconscious bias, or outdated assumptions, fail to provide older patients with clear, comprehensive explanations about their health. This often stems from a mistaken belief that seniors won't understand complex medical information or aren't capable of participating fully in their care decisions. In some cases, doctors may simplify explanations to the point of omitting critical details, such as potential side effects of a new medication or the rationale behind a treatment plan. In others, they may direct conversations to a caregiver or family member, effectively sidelining the patient and leaving them feeling like a bystander in their own healthcare journey. This lack of clear, respectful communication isn't just disrespectful, it's dangerous. A 2022 study published in Health Affairs found that seniors who feel excluded from medical discussions are 30% more likely to misunderstand medication instructions, miss follow-up appointments, or fail to adhere to treatment plans. For example, a doctor might prescribe a new blood pressure medication but gloss over potential side effects like dizziness, assuming the patient won't get it, or that a caregiver will manage the details. This can lead to preventable complications, such as falls, drug interactions, or hospitalizations. Similarly, when doctors address caregivers instead of the patient, it can undermine the senior's confidence in managing their health, increasing the risk of errors or non-compliance with treatment. This communication breakdown has far-reaching consequences. Misunderstood instructions can lead to taking medications incorrectly, skipping critical screenings, or delaying necessary treatments, all of which can exacerbate health issues and diminish quality of life. For instance, a senior who doesn't fully understand the importance of a follow-up test for a suspicious finding might delay scheduling it, allowing a treatable condition to progress. Over time, these communication gaps can erode trust in the healthcare system, making seniors less likely to seek care or advocate for themselves. What you can do to ensure clear communication. Taking an active role in your healthcare conversations is essential to bridging this communication gap. At the start of your appointment, set clear expectations by saying, "I want to understand every aspect of my condition and treatment. Please explain it directly to me in clear, detailed terms." If the doctor uses medical jargon or rushes through an explanation, don't hesitate to ask for clarification. "Can you explain that in simpler language?" Or, "Can you go over that one more time to make sure I understand?" Bring a notebook, tablet, or smartphone app to record key points, such as medication changes, test results, or follow-up instructions. If the doctor begins addressing a caregiver instead of you, politely redirect them by saying, "I'd prefer you speak directly to me, as I'm managing my own care." If you have a caregiver present, clarify their role as a supporter, not a substitute for your involvement. For complex discussions, consider recording the conversation, with permission, or asking for written materials to review later. By asserting your right to clear, direct communication, you can reduce the risk of misunderstandings and ensure you're fully equipped to make informed decisions about your health. Truth 4. Your pain is often underestimated. As a senior, you may find yourself grappling with chronic pain, mobility limitations, persistent fatigue, or other debilitating symptoms that significantly impact your daily life. Unfortunately, these issues are all too often dismissed by healthcare providers as an unavoidable consequence of aging, a misconception that can leave serious conditions untreated and your quality of life diminished. Whether it's arthritis causing joint stiffness, peripheral neuropathy triggering burning sensations in your extremities, fibromyalgia contributing to widespread pain, or even undiagnosed issues like infections, autoimmune disorders, or cardiovascular problems, the assumption that discomfort is just part of getting older can prevent proper diagnosis and treatment. A 2023 study published in the Journal of Gerontology highlighted a troubling statistic. Seniors are 40% less likely to receive adequate pain management compared to younger patients. This disparity often stems from a pervasive bias among medical professionals who view pain, fatigue, or reduced mobility as normal for older adults, rather than symptoms warranting thorough investigation. This dismissive attitude has far-reaching consequences that extend beyond physical discomfort. When your pain or symptoms are minimized, it can lead to feelings of frustration, invalidation, and even hopelessness, eroding your confidence in the healthcare system and in your own ability to advocate for yourself. The emotional toll can be profound, contributing to mental health challenges such as anxiety, depression, or social isolation. For instance, if chronic pain prevents you from enjoying hobbies, spending time with loved ones, or even performing basic tasks like dressing or cooking, it can foster a sense of disconnection and diminished self-worth. Over time, the cycle of being unheard or undertreated may discourage you from seeking care altogether, allowing manageable conditions to worsen and potentially leading to more severe health complications, such as mobility loss, falls, or hospitalizations. The reality is that pain, whether physical or emotional, is not an inevitable part of aging, and you have every right to expect comprehensive, compassionate care that addresses your unique needs. What you can do. To ensure your pain is taken seriously, you must adopt a proactive and persistent approach to your healthcare. Start by meticulously documenting your symptoms before every medical appointment. Keep a detailed journal that includes the location, intensity, frequency, and duration of your pain, as well as specific examples of how it affects your daily activities. Whether it's difficulty climbing stairs, interrupted sleep, or an inability to engage in cherished pastimes like gardening or socializing. Using a standardized pain scale, 1 to 10, where 1 is minimal discomfort and 10 is unbearable, can help translate your subjective experience into a concrete metric that healthcare providers can better understand. Additionally, note any factors that worsen or alleviate your symptoms, such as specific activities, times of day, or medications. When meeting with your doctor, present this information clearly and assertively. If your concerns are met with dismissive responses like, "This is just aging," or "You'll have to live with it," don't hesitate to challenge them. You might say, "This level of pain or fatigue is not normal for me, and it's significantly impacting my life. I'd like a thorough evaluation to identify the cause and a detailed plan to address it." If your primary care physician is unresponsive, consider seeking a second opinion or consulting specialists such as pain management experts, rheumatologists, neurologists, or orthopedic surgeons, depending on your symptoms. Integrative medicine approaches, such as physical therapy, acupuncture, massage therapy, or mindfulness-based techniques like meditation, can also complement traditional treatments and provide relief. Beyond medical interventions, connecting with support networks can be invaluable. Look for local or online support groups for seniors with chronic pain or specific conditions like arthritis or neuropathy. These communities can offer practical advice, emotional encouragement, and a sense of solidarity, reminding you that you're not alone. If navigating the healthcare system feels overwhelming, consider enlisting a family member, friend, or professional advocate to accompany you to appointments. They can help articulate your concerns, take notes, and ensure your questions are answered. Above all, trust that your pain is valid and deserves attention. Your health and well-being are worth fighting for. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Truth 5. The system punishes seniors who don't advocate. The U.S. healthcare system is a complex and often unforgiving landscape, particularly for seniors. It tends to favor those who are assertive, well-informed, and persistent in demanding high-quality care, while those who remain passive or deferential risk receiving substandard treatment. Seniors who avoid bothering their doctors, accept vague or incomplete answers, or fail to question their care are more likely to experience misdiagnosis, inadequate treatment plans, or preventable health complications. A 2024 report from the Kaiser Family Foundation highlighted this disparity, noting that seniors with low health literacy or a passive approach to their care had a 25% higher rate of emergency room visits, often due to untreated or poorly managed conditions. Doctors, like anyone, are human, subject to time constraints, stress, and occasional biases. Some may unconsciously prioritize younger patients or those who appear more vocal, assuming seniors are less likely to challenge their recommendations. However, your age does not diminish your right to exceptional care. In fact, it underscores the importance of receiving it. You've spent decades contributing to society, raising families, and building a life. You've earned the right to live comfortably and with dignity. Advocating for yourself is not just about securing better treatment. It's about reclaiming your autonomy and ensuring your health needs are met with the respect and urgency they deserve. What you can do. Becoming your own advocate is critical to navigating the healthcare system effectively. Start by preparing thoroughly for every medical appointment. Create a concise, written list of your symptoms, questions, and specific goals for the visit. For example, if you're experiencing fatigue, note when it occurs, how long it lasts, and how it impacts your life. Bring a notebook or use a smartphone app to track your health metrics over time, as this data can provide compelling evidence to support your case. During appointments, don't shy away from asking direct, pointed questions, such as, "What could be causing this issue?" Or, "What tests or treatments do you recommend, and why?" If you feel your concerns are being overlooked, politely but firmly restate your needs. "I don't feel like my concerns are being fully addressed. Can we discuss this further?" Bringing a trusted family member or friend to appointments can also help, as they can take notes, ask additional questions, or reinforce your advocacy efforts. If you encounter persistent barriers, consider enlisting external support. Patient advocacy groups, often available through hospitals or non-profit organizations, can provide guidance and resources. Geriatric care managers, who specialize in coordinating care for older adults, can also help navigate complex medical systems, ensuring your needs are met. Above all, never feel guilty for bothering your doctor. Your health is their primary responsibility, and advocating for yourself is an essential step toward living a healthier, more fulfilling life. As we wrap up these eye-opening truths about what doctors really think of seniors in America, I hope you felt that fire to take charge of your health like never before. You've heard the brutal realities, from ageism stealing opportunities to rushed visits risking your future, but more importantly, you've got the tools to fight back and demand the care you deserve. So, tell me in the comments below, what's one key lesson you've learned so far that you're committing to bring into your next doctor's visit or daily life? Whether it's preparing a symptom list, speaking up against dismissal, or advocating louder for your pain, share it with us and inspire others. If you found this video helpful and empowering, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more life-changing advice on thriving as a senior. Your voice matters. Let's keep the conversation going.